First, we have 2,469 cases of coronavirus in Victoria. That is 108 more than yesterday. The breakdown of those, and of course Annalise will be only too happy to take you through any further details that you might want, but at a top level, 14 are linked to controlled outbreaks, 25 are the result of routine testing, 69 of those cases are under investigation by our public health team. We have 509 active cases across Victoria. Yesterday, in what we believe is a record in single-day testing, 25,553 Victorians were tested, taking our total tests to 906,574 since the beginning of the year. 25 Victorians are in hospital. That number is slightly up, but we have 3 people in intensive care, and that number is down. Now, in terms of those numbers, what that essentially says to us is that we are doing more searching than we've ever done. That, of course, means that in accordance with the strategy, you find more and more cases, and you've got to then deal with the challenges that that throws up. Many thousands of close contacts, many thousands of Victorians who need to be monitored, who need to be supported in terms of quarantining at their homes. The challenge today is that we have got unacceptably high numbers in 2 further postcodes. And whilst it gives no one in the public health team nor the government any joy to have to announce that postcodes 3031 and 3051 will be the subject from 11:59 p.m. tonight of the stay-at-home order, where there is only those 4 permissible reasons to leave your home. Businesses in those affected suburbs and households will receive support in line with the other 10 postcodes, further to our announcement earlier in the week, and we will provide any and all support that we can to those who are affected. Those entire postcodes are essentially added to the suburban lockdown from 11:59 p.m. tonight. Further, and this is in many respects the most challenging issue that we have dealt with throughout this entire global pandemic, 9 public housing towers in those postcodes will be the subject of a complete lockdown, effective immediately. Those residents, and I'll take you through the numbers in a moment, and Richard can give you a list of those 9 public housing towers. Given that there are positive cases in a number of those towers, and given the very high density of that nature of housing, the number of shared facilities, everything from laundries to obviously access and egress points, lifts, etc., the public health advice is to close those 9 towers. There will be no reason for any of those residents to leave their home for a period of at least 5 days, effective immediately. We don't take that step lightly. We know and understand that it is a big cohort. It is also a group of people, many of whom are amongst the most vulnerable in our Victorian community. But the risk to public health at a personal and family level, the health and well-being of those residents who all live very close to each other, the fact that there are positive cases in some of those towers and logical patterns of movement, friendship groups, family groups, mean that the best and most appropriate step is to be hard lockdown in those 9 towers. I again make the point that is effective immediately. Before I take you through the chain of command and the Victoria Police response to deliver that hard lockdown, let me just share with you some numbers as to those 9 towers. There are 1,345 units of housing within those 9 towers, and there are approximately 3,000 residents, that is adults as well as dependent children, that live in those 9 towers. So it is a very significant cohort, a very large group of people. The Minister will speak in more detail and give you the list, but we will provide any and all support to those impacted residents. There will be no one going in other than residents who are returning home, and no one will be allowed out of those public housing towers. There will be a massive logistical task to make sure that those people are fed, given the support that they need. I think we're equal to that task, and I don't for a moment underestimate how challenging, how traumatic in some respects that will be for those 3,000 residents. Richard can take you through some more detail in relation to the location of those towers and some of the support that we are looking to provide. Those matters are not quite settled yet. We'll have more to say about very targeted and specific support tomorrow. Can I inform you that there's been many conversations with Victoria Police today about how to give effect to these orders. I can indicate that out of the State Control Centre, Commander, Victoria Police Commander Mick Herman, who many of you will remember the outstanding leadership he provided in the evacuation process. Many tens of thousands of people evacuated from their homes during this summer's bushfires. He will be in charge of the police operation. This will be at least 500 officers per shift. There will be a number of VicPol staff on each floor within these towers, and then a larger number of Victoria Police members will essentially police that hard lockdown at access points to these towers. There will be a cordoning off. There'll be some distance between where members of the general public can go and these towers. Can I just appeal to media and to everyone? There are many, many vulnerable people who live in these towers. Some of them will be returning home in the latter part of today, knowing that they will not be able to leave their home for a further 5 days, at least 5 days. I would ask that we all be as sensitive as we possibly can as to the privacy and the fragility that many of those people will be experiencing right now. This is a very significant step, not one that we've had to take before, but it is for the protection of those residents and the broader community that we take this very difficult step. The police presence and the police operation will be unprecedented, and Victoria Police are well placed to do that important work, particularly when you think about the amazing logistical effort that they put in during the bushfires earlier this year. Can I just say to all Victorians, these numbers are a very real concern to all of us. That's why it is so important that if you have symptoms, you come forward and get tested. If you are unwell, the only reason to leave your home is to get tested. If someone knocks on your door and asks for you to take a test, please be sure and answer yes. It is a massive contribution that you can make to the health and welfare of your family and every family. All the way along, we've said the data would drive us. There is some precautionary principle being applied in these additional lockdowns, but we have such numbers, we have evidence of sufficient cases to see the public health team advise me only a short while ago to take these steps. They're not taken lightly. We at no point underestimate how challenging this will be for families and businesses, particularly those families, many of whom are vulnerable in those public housing towers. But for their safety and the safety of all Victorians, this is the right approach. These are the steps that need to be taken. Can I just send a message again to everybody in those now 12 lockdown suburbs? You are on the front line of our fight against this virus. We are proud of you. We understand that you need support, and we will get that support to each and every one of you as best we possibly can. Your family's safety is important, and these measures are designed to deliver that. But your sacrifice and the contribution that you are making is central to the safety and well-being of every Victorian family. You have our gratitude. We are proud of the job you are doing, and we understand that there is a big need, a really big need, for us to continue supporting you, and we will. To the rest of Victoria, if you want to show your gratitude to all of those who are locked down and who are on the front line of this battle against coronavirus, please follow the rules. It's not that challenging. Keep your distance, wash your hands, cough into your elbow, and just use common sense. If you're sick, you can't go out, unless, of course, you're going out to get tested. If someone knocks on your door, because there is door knocking going on across the whole city, please be sure and consent to a test. Just before I throw to Richard to take you through some more detail of these public housing units, I just want to explain the order is made for 14 days. That's a function of the Act. It can be rescinded at any point. We will, the 9 towers that are being locked down will be locked down for at least 5 days, because that is deemed the appropriate period to test everybody, every single resident, other than those who've already tested positive, across those towers, and to have those tests processed by the labs. That data will then guide us as to what the next steps should be. But at this stage, it is at least that 5-day hard lockdown effective from right now. As to the postcodes that have been added in, that will be consistent with the other 10 postcodes until the end of this month, and we will reassess at that point, or indeed sometime before then. I'll now ask Richard to speak to you about those individual housing estates, those public housing towers, and at least some early thoughts on the sort of support that we can provide them, those 3,000 people, and then we're happy to take any and all questions you have.
Thank you very much, Premier. And the 2 suburbs that the Premier has today announced, of course, are host to some of our biggest public housing estates, both in Flemington and in North Melbourne. And we know that those public housing towers, they're high-density towers, and as the Premier has indicated, we will be locking down 9 of those towers. But these are home to some of the most vulnerable people in our community, and we must respect that and honour that. And I know absolutely that we will do everything that we possibly can to support these people at this very difficult and challenging time. In that context, of course, we will have a bit more to say, particularly in the next couple of days, about potential for rent relief and indeed possible hardship payments. But we'll have more to say about that at a later point. But what I want to reassure all of our public housing tenants who are affected by this, that we will put in place all of the measures that will be required to support them in the most practical way, whether it's in relation to medical support, whether it's in relation to mental health support, drug and alcohol support, obviously the most basic things around food, and in that context, we believe that what we are going to be putting in place here is incredibly important, because we will always as a government stand by the most vulnerable in our community. And certainly many of those people, of course, are those who live in our public housing towers. I want to take you through where these towers that are going to lock down are. So as the Premier has indicated, there are 1,345 units and there are approximately 3,000 residents living in those units. And they are in the 2 suburbs. So in a suburb of 3031, which is Flemington, 12 Holland Court, 120 Racecourse Road, 126 Racecourse Road and 130 Racecourse Road are all subject to the lockdown. These are all high-rise towers. They are all, as the Premier has indicated, that they all are characterised by having common lifts, common entrances and common walkways within the flats themselves. So on the expert advice of the Chief Health Officer, and we believe that they present an acute challenge going forward. In relation to North Melbourne, there are the following sites will be subject to the lockdown: 12 Sutton Street, North Melbourne; 33 Alfred Street in North Melbourne; 76 Canning Street in North Melbourne; 159 Melrose Street in North Melbourne; and 9 Pampas Street in North Melbourne. Again, all of those are mid-rise or high-rise towers. We think that this is the appropriate action for the government to take in the context of ensuring that we address the obvious infections that are in both of those facilities at the moment. Both of those areas, but in fact that we protect our residents going forward. And I just want to reiterate the point that the Premier has made. People living in these public housing towers are some of the most vulnerable people in our community, that many of them are subject to comorbidities, and we want to ensure that we wrap around them all of the services that they are going to need, not just over the next 5 days or indeed potentially the next 14 days, but going forward, that we provide them with all of the support they need to maintain their tenancy, but obviously to maintain their wellness also. Thank you.
Happy to take any questions you have.
Premier, I guess the devil's advocate would say that is this going to be handled better than a hotel quarantine?
Well, I can indicate to you that Victoria Police are in charge of this important work. That's both from a public order point of view, but also maintaining the security of this lockdown. That is, I think, that is exactly the right way to go. And Victoria Police are, as we speak, in place to ensure that people are not entering other than those who are residents returning home, and that people are not leaving if they are resident in those towers. There is, under these lockdowns, unlike suburban stay-at-home orders that are currently operating, and where 2 postcodes will be added from 11:59 p.m. tonight, where there are 4 reasons to leave home. If you're in one of those towers that the Minister has just read out, then you will not be allowed to leave your unit, your dwelling within that tower for any reason. That is not an easy decision to make, but it is the appropriate decision to make. If I can draw an analogy, it is not dissimilar to the way aged care facilities are treated if there is a positive case, let alone an outbreak, in an aged care facility. Such is the vulnerability and the susceptibility of many in that cohort, many residents in those towers, that to do anything else, as difficult, as unique as these steps are, unprecedented, would be to not follow the public health advice and would pose an unacceptable risk to the health and well-being of those who live in those towers, and indeed, by extension, the health and well-being of every single Victorian.
With us getting the second biggest day of cases and the biggest jump since March, how much responsibility do you need to take for that and how you have handled COVID?
I've spoken at length about the authority and the chain of command in our state. I don't think I need to add to that other than saying I'm the Premier of the state, I'm the leader of the government, and I'm accountable and responsible to get this job done. That's why I'm focused on that job, not focused, can I say, on things I can't change. We've got an inquiry into those matters. That's the appropriate way to go. That's at arm's length. What I need to be focused on now, and I am exclusively focused on, is dealing with this challenge and making sure we've got the right policy settings and that we are testing as many people as possible, providing support to those who need it, and trying to stabilise these numbers and drive them down. That is why I'm so grateful, noting that no team, even teams as big as the one we have assembled, many thousands of people, from door knockers to laboratory technicians to public health coronavirus detectives, there are many, many thousands of them, but none of us can do this on our own. We need those who are the subject to restrictions to follow the rules. We need all Victorians to follow the rules. We can't simply let our frustration get the better of us, and of course everybody is frustrated. Everyone would love this to be over. They desperately want this to be over. The fact is that we can't just go back to normal, where if you've got a sniffle, you just go about your business. This is wildly infectious, and all of us must accept the fact that we can't go back to normal. We've got to go back or find a COVID normal. That's what we have to do, and that's going to involve all of these basic common sense rules being followed by everybody. And I again make the point, I know and understand the level of frustration, the level of fatigue with this global pandemic, but we've got to stay the course. We've got to keep all of us playing our part. And for those who are not in lockdown suburbs, let's all of us show our gratitude. Let's all of us show our gratitude to those who are making a larger sacrifice because the virus is in their local community. And the best way we can thank them and show the fact that we are proud of the job they're doing on the front line of this virus is to follow the rules ourselves. That's what I'd ask of every single Victorian. The alternative is this gets right away from us, and we've got not just 12 postcodes locked down, but every postcode lockdown. I don't want to get to that point.
How likely do you think that would be?
I'm not about speculating when it comes to these things. The data will drive us. We'll have more to say. These additional postcodes that are added in tonight, with no joy, no sense of anything other than, a really clear appreciation that this will cause pain, but the pain it causes, the frustration or the difficulty that it causes, is nowhere near the difficulties that will be experienced if we have this get right away from us. We have seen across the week some stability in these numbers. The fact that our testing rates are going up and up and up, and we are finding more cases, is in fact a suppression strategy working. No one's pleased to be in this place, but unless you find cases, you can't wrap your arms around those positive cases, isolate them, quarantine them. You simply can't. It is always better to have the clearest of pictures, and that's why I'm so proud of all of those and grateful to all of those Victorians. I believe this is certainly a Victorian record, more than 25,500 tests in a single day, and we will continue to see that sort of testing rate, those sorts of testing numbers, provided, of course, Victorians across the board, regardless of their postcode or their circumstances, if you have symptoms, even mild symptoms, come forward and get tested, because that gives us the data, that gives us the most complete picture of where this virus is, and then it allows us to bring the fight to the virus. Much like a bushfire, and this is a public health bushfire, we need to contain it and then ultimately put it out. But if you can't find it, if you don't know where it is because people aren't getting tested, then that task just becomes much, much harder.